Hi, I'm David White. This is my first video blog as president of the College of Family Physicians of Canada. I want to explore several key challenges in healthcare in our country and what can be or is being done to improve the situation. There are 4 areas I'd like to discuss. 1. Healthcare patterns of use have changed dramatically over the years, but the system has not kept pace with these changes. It's out of date in terms of keeping up with technology, meeting the needs of shifting demographics, addressing the changing expectations of patients, and responding to changes in how physicians work. Also, funding is still heavily focused on hospital care, which is expensive and episodic. 2. Canada lacks an adequate plan for forecasting and meeting health human resource needs. We have insufficient availability of health professionals in rural and remote areas, and the appropriate mix of care providers needed is not well defined. 3. Leadership in healthcare at the federal level has been largely lacking for the past decade. Primary care reform has suffered as a result, and we have a lot of work to do to improve access to care across the country. Since its election more than a year ago, the new government's efforts in healthcare have focused on mental health and home care in the context of limited resources. And that brings me to number 4. Growth in health spending decreased in recent years following the recession of 2009. So, more than ever, we need to use that funding more wisely. So, what can we do to resolve these issues? A lot, actually. To meet the changing healthcare needs of our population, we need to invest more in community-based primary care to help keep populations healthy. We also need more primary care research to support evidence-based decision-making. The college, your college, is actively working in these areas. One example is our collaboration on a national action plan for better home care in Canada. We're also exploring ways to encourage members to engage more in research, and that includes aspects of medical education. Overall, a better understanding of what care is needed and how it is best delivered will help shape how we train future family physicians to meet those needs. The second and third issues I pointed to, the need for health human resource planning and leadership from the federal government, are intertwined. We need a national vision to improve access to care across the country. As the college noted in our 2016 report card on government performance in healthcare, the government has a role to play in improving recruitment and retention of family physicians, and in investing in efforts to improve timely access to care. In 2004, it established the Pan-Canadian Health Human Resource Strategy. It was to attract, prepare, and retain healthcare providers. However, there are still too few specific strategies and inadequate infrastructure in place to measure the performance and guide the production of the Canadian health workforce. I urge the government to revisit this strategy, and we will continue our advocacy work in Ottawa to support these efforts. I also hope to see greater cross-sectoral collaboration between healthcare jurisdictions to address any barriers to healthcare delivery, such as cross-provincial licensing that would allow individuals to improve rural and remote locum coverage. Makes sense. Finally, in terms of healthcare funding, there are many innovative and cost-saving programs across Canada that could be scaled up, and this needs to happen more. There are also initiatives, such as a potential national Pharmacare program, that are poised to save money while improving patient care and access. But they may not be getting the attention they deserve due to short-term costs and political risks. And let's always remember, strong primary care is the foundation of a cost-effective healthcare system. CFPC serves as the voice of family medicine in Canada, and as such, we will continue our efforts to advocate for measures that improve access to care for all Canadians. I encourage our members to also voice their concerns and especially to share their ideas about how to improve health care. Please feel free to connect with me via email or Twitter or leave a message in the comments area below this video. I look forward to hearing from you.